All right, let's just forget the textbooks for a minute. We're diving straight into one of the most intense environments in medicine, the casualty ward. This is all about cutting through the chaos and zeroing in on what you have to do in those first 5 minutes. You know, the moments where every single second counts.
And this really gets to the heart of it, doesn't it? The casualty ward is no place for second guessing. It's a place for instinct, for muscle memory, for decisive action. All the thinking, that has to happen before the patient even rolls through the door.
And that's exactly what this is for. Think of this as your compass, a clear, simple guide to help you build that instinct. So when the pressure is cranked up to 11, you're ready to make that first move, and you're going to make it with confidence.
Okay, so first things first. Every pro needs their toolkit, right? Before you can act, you got to know your instruments. So let's stock our mental emergency tray with the absolute must-have life-saving ampoules that you need to know like the back of your hand.
First up, the 2 heavy hitters. You've got adrenaline, which is basically your ultimate restart button. We're talking a heart that stopped or a body in full-blown anaphylactic shock. And that note on the screen? It's non-negotiable. Keep it ready, period. Then there's atropine. Think of this as the accelerator for a heart that's beating way, way too slow. It kicks in super fast to get that heart rate back where it needs to be.
Now, this is a really cool contrast. On one hand, you have drugs like dopamine or noradrenaline that are designed to crank up the blood pressure when a patient is in shock. They're powerful and you need so much precision that they have to be given through an infusion pump. But on the other hand, you have sedatives like Diazepam to quiet a storm in the brain like a seizure. But look at that warning. You calm the brain down, but you better be watching to make sure you don't calm their breathing down too much. It's a real balancing act.
Okay, here we're looking at 2 totally different ways to fight a fire. First, you've got hydrocortisone. That's a powerful steroid that basically tells a massive, out-of-control inflammation to stand down. Think of a severe asthma attack. Then you've got tranexamic acid, or TXA. This one is less about chemistry and more about mechanics. It helps the blood form clots to stop severe bleeding. And with TXA, timing is everything. In a trauma situation, you've got to get it into the patient within 3 hours. The clock is literally ticking.
All right, let's talk about 2 situations that are super specific but absolutely deadly if you miss them. First, hypoglycemia. Blood sugar craters, and the brain is starving for fuel. Dextrose is pure, fast-acting energy. The protocol couldn't be simpler. Check the sugar, then push the dextrose. Then there's Magnesium sulphate, a powerhouse drug for stopping seizures in pregnant women with eclampsia. It works, but it's strong, so you have to keep a close eye on the patient's reflexes and breathing.
I love this analogy. Think of this as plumbing versus ventilation. Both are for a patient who can't breathe, but they fix totally different problems. Furosemide is the plumber. It gets the kidneys to pull a ton of excess fluid out of the body when it's backing up into the lungs. Deriphyllin or Salbutamol, they're the ventilation crew. They go straight to the airways and crank them open during an asthma attack.
So we've stocked the toolkit. Now for the fun part. Let's actually put these tools to work. We're shifting from the what to the how, applying this knowledge in the real-world scenarios you're going to face the second the patient comes through the doors.
When a trauma patient hits the door, your brain needs to go on autopilot. And that autopilot has one program, ABC, airway, breathing, circulation. There's a reason this is the absolute bedrock of emergency medicine. Because if you don't have an airway, nothing else you do matters. You can't breathe without a clear path for air, and you can't circulate blood without breathing. That sequence is sacred. It saves lives.
Anaphylaxis is a 5-alarm fire inside the body. The airway is closing up, blood pressure is tanking, it's a full-blown catastrophe. There is only one first move. Step 1 is adrenaline, in the muscle immediately. It is the only thing that actually reverses what's happening. Oxygen, fluids, yeah, they're important support, but adrenaline is the hero here.
Someone comes in with chest pain. Rule number 1, you assume it's a heart attack until you can prove it's not, period. And this protocol is all about tackling that head-on. Aspirin to stop clots from getting worse, an ECG to see what the heart muscle is actually doing, and oxygen to ease its workload. Your job is to find out if this is a cardiac event and find out fast.
When someone is actively seizing, they are completely vulnerable. Your first job is simple. Protect them. Protect their airway and get them on their side so they don't choke. It's not about stopping the seizure right away. It's about keeping them physically safe while it's happening. Once they're safe, then you can go in with meds like Diazepam to stop the seizure itself. Safety first, always.
If there is one phrase you burn into your brain from this whole thing, let it be this one. Time is brain. When someone's having a stroke, a part of their brain is literally being starved of oxygen and dying. Every single second that ticks by, more of that damage becomes permanent. This isn't just a catchy phrase, it's an urgent command.
You know, reacting to a crisis is one thing, but the real pros, they see it coming. This is about sharpening that clinical sixth sense, learning to spot the massive red flags that tell you a disaster is about to happen before it fully unfolds. These are the signs you just cannot afford to miss.
So these are your absolute drop-everything red alert signs. Someone who can't catch their breath, a person who suddenly gets confused or just checks out, a high fever with a stiff neck, you gotta think meningitis, any blood where it shouldn't be, or the telltale signs of a blood sugar disaster. Any one of these means it's go time.
Yeah, we're bringing this one back because it is that important. This specific pattern of pain is the classic textbook sign of a heart attack. There is no gray area here. The only right and safe thing to do is to assume it's a heart attack and go all in until you have solid proof that it isn't.
Now, this is so important because it's easy to miss. You might see a pregnant woman with a really bad headache and think, okay, that's common. But you see a seizure, and it's an obvious emergency. The key takeaway? In this context, they're the same thing. Both of them are screaming eclampsia, and both demand the exact same response, magnesium sulfate, right now.
Okay, so we've got our plan for a seizure, but seizures are supposed to stop, right? They kind of run out of steam after a minute or two. So what happens when one doesn't? What if it just keeps going, and you're watching the clock tick past that 5-minute mark?
Yeah, that's when you've entered a whole new level of emergency. This is status epilepticus. It's not just a seizure anymore. It's a full-blown neurological crisis. The brain is stuck in a loop that can cause permanent damage. This needs fast, aggressive treatment to break that cycle.
We've looked at the tools, the game plans, the warning signs, and it all comes back to this one simple concept, your first move. Because when that moment hits, it's not panic that saves a life, it's preparation.
I'm going to leave you with just one number, 3. In a major trauma with major bleeding, you have 3 hours from the time of the injury to give tranexamic acid for it to have its best chance of saving a life. 3 hours. It's just a number, but it represents a window of opportunity that, once it closes, is gone for good.
So let's bring it all home, because it's not a question of if the emergency will happen, it's when. The only thing you can control is how ready you are. So when the chaos starts, when that alarm sounds, what's going to be your first move?